Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello and welcome to the Healthy Habits for Active Aging podcast. This is episode number 22. This is what stem cells can do for you. My name is Dr. Michael Gorman.
And I'm Dr. Lauren Bennett.
We are two physical therapists located in St. Louis, Missouri. And today we're going to be talking, as I said, about stem cells and regenerative medicine. And I'm sure that most of our audience has heard about this topic. It's become quite the buzzword, I'd say, for 10 years. So we're going to talk about this, and we're doing this because we're excited to talk about this topic. We think it can help a lot of people, not everyone, but can help a lot of people. But also, this is to prep for next week when our guest is Dr. Matt Bays with Blue Tail Medical in St. Louis, Missouri. And he and his group have been doing, they call it orthologics, which is regenerative medicine. They've been doing it for years and they do a very good job with it. So we're doing this to sort of prep everyone for next week's podcast.
Mm-hmm. Yes, and there's just been a lot more information coming out and a lot more interest on this thing called regenerative medicine.
I know it's a tough word to say. I get that. That's tough.
Regenerative medicine. So we've talked in a prior podcast about this thing called platelet-rich plasma, also known as PRP, and a little bit on stem cells. So today we want to bring what are stem cells, what can they do for you? And then next week, like Dr. Gorman said, is when we'll actually get the expert to talk about how he implements and uses stem cells and PRP with his patients. So.
Absolutely. So, again, we aren't the experts on this, but we are definitely going to be talking about this. But we're going to talk, first of all, like what are stem cells? And stem cells are just cells that take on the properties of the cells they are surrounded by. So, Dr. Bennett, explain that real quickly. Talk about the undifferentiated stuff.
Yeah. So they're undifferentiated cells. Like, what is that? So essentially, they are cells that they don't belong to anything. When you inject them somewhere, whether it's a ligament or a tendon or a joint or muscle, they can recognize where they're at and essentially grow to become that.
That's amazing. It's so amazing that the body has that ability. It's crazy to think that. But yeah, so these cells, so when they do a stem cell injection, they take the stem cells from your either your bone marrow, or they can also take it from fat as well. And so with the bone marrow, they essentially are taking it from the pelvic area. And I know that doesn't sound very fun, but if you go to the right person, they do a very good job with it.
Yeah, stem cells can come from more than just bone marrow and fat, but those are most commonly that we see. And yeah, Dr. Bays will say that he, a good person that can take bone marrow out of a part of your pelvis, you shouldn't really even feel it. I thought that sounded horrible. But when he talked about it last week, I was like, oh, he makes it seem like it's kind of a breeze. So ask your doctor about that one.
For sure.
But,
so, this can be used with really many things, non-healing fractures, osteoarthritis, especially in the knee. It's been found to be very, very effective. Achilles tendonitis, that ugly thing called plantar fasciitis, which is the pain on the bottom of the foot. Also, if you have a torn rotator cuff, I think it's in, Dr. Bays will talk more about this, but it's not the panacea. It's not the cure for everything,
right,
nor does it help every single person. But if you go to a well-trained physician that's well-versed in orthologics, they will be able to know who the right candidate is. So it gives you the chance of getting a better outcome.
Yes, that's a good point. Like, it may delay you from getting a total knee or shoulder replacement, but if you need to go to the doctor and they need to do an evaluation and say if you're a candidate or not, because essentially, we'll get to it, but it's not covered by insurance. And then if you're just going to do that, when really you're a candidate for a replacement because things are just too torn or too far gone, like you need to talk to your doctor about it. But
Sure. And this is not covered by insurance. So that's something everyone, I think we're going to talk about it here shortly, but
Mhm.
it's not covered by insurance. So it is an out-of-pocket cost, but seeing, at least in St. Louis, the growth of Blue Tail Medical, it makes me, I have a lot of faith in it that is helping a large number of people.
Mhm. Yes.
And
So
oh, sorry, go ahead.
no, go ahead. Go
And
ahead. Say
also,
what you're saying.
there's many other things that there's being research done about. And I was looking the other day on stem cells that are being used with patients that have Parkinson's. And
Mm.
that's something that, it's not uncommon for an aging adult to develop Parkinson's. And so the studies, they're in their early phases, early trials, and they feel like right now we're still about 4 to 8 years away from stem cells being used to help patients that have Parkinson's. But it's still pretty exciting to know that this science and these studies are going on that we don't even know about. And I do think will have a huge impact on just chronic illness, chronic disease. I believe Dr. Bays was talking about how it's being used in people with diabetes as
Mhm.
well. So it's exciting to see what it can do. But anyway, we're kind of getting off track here. So let's keep going on with what stem cells are, Lauren.
Yeah, so we just talked about how they're undifferentiated cells. And they recognize the area that they are then injected to and can grow to become that to improve healing. So we'll leave this part up to Dr. Bays next week about, how many injections that entails, what are the purpose of the injections. But from a physical therapy standpoint, a lot of times after you have the injection, they may prescribe or hopefully will prescribe therapy because essentially you have to think about there's wear and tear over time, which led you to this tendinitis, which led you, which is just an inflammation or
Mhm.
arthritis, of the joint or the tendon and breakdown. So when you get to the point of breakdown, it's the tendinosis. And that's when the stem cells can really help work. But that just doesn't happen for no reason, usually, unless there's trauma. So, say you have bad posture or bad mechanics or bad shoulder blade positioning, and if you have a really bad, awkward shoulder blade position every time you raise your arm up over your head and you're impinging over time, I always explain it to my patients like a rope on a rock. Over time, you're going to fray that. And yes, while you can get stem cells to go in there and kind of cure it to a certain extent, I shouldn't say the word cure, it's not cure, kind of heal it to a certain extent.
Mhm.
If you don't fix the rope on a rock, you're not going to get anywhere. You're going to be in the exact same position you just were. So, physical therapy after that, they can help fix that through strengthening the right muscles, stretching the right muscles, and just working on movement mechanics. So,
Absolutely.
little disclosure there of why PT works so much more helpful. Because if you're really going to put the money out for stem cell injections, since insurance
Mhm.
doesn't pay for it, like why not do the whole process and get
Mhm.
physical therapy with it as well?
Yep, yep. Um,
So,
and so when we think about stem cells, uh, you know, a lot of people get cortisone injections. I know we talked about cortisone a couple of podcasts back, I believe. Um, you know, the problem is with cortisone, and again, I'm not going to say it's good or bad. That's not my place, but it decreases inflammation, which is a great thing. Yes, you absolutely should get physical therapy after the cortisone injection because the cortisone is just calming your inflammation, but it doesn't do anything to make you more mobile, make you stronger, anything like that. Um, but you know, I would say that again, I get it. It's a cost that's not covered by insurance, but I personally, if I had an issue that I could either get a cortisone injection or I can do stem cell, and stem cell is going to obviously last for a longer period of time using my own cells. again, if you can afford it, it makes sense, because this to me is a longer lasting option than just getting a cortisone shot or getting a cortisone shot every 3 months. And we know that there's negative effects long term to cortisone as well. So
Right. Okay. So now you may be thinking, now that I've had the injection, what should I expect? Like, are there risks to this procedure? And that is one of the coolest things about this procedure, is that you are taking cells from your own body. So there's no risk of rejection. And then, there could be a little risk of infection, but it's really, really uncommon. But it's rather, there are no risks, essentially. I mean, talk to your doctor about it, but it's just a very low risk thing. I mean, what's the biggest risk to me would be, I paid all this money for the injection, it didn't work.
right.
That would be my biggest concern. But there's a lot of research out there, in specifically orthopedic conditions, that it does work. And you'll want to know, well, how long does it work for? Hopefully forever. But essentially, what the research out there says is that you should find relief within the first 3 to 6 weeks, but it will be fully healing still at 12 months. Usually 12 months is the end there. But I think Dr. Bays will go over this more so next week. But what I think I learned from him is usually 5 to 7 years. So, if you're thinking about a series of harmful cortisone injections over time that are going to break down tissue even more and cause cartilage damage, if this is going to last 5 to 7 years, have a more longevity, and then you're going to be working with physical therapy as well. I mean, it's something worth talking to your doctor about.
Yeah. And I think it's important. I think that to have realistic expectations, that if you have a arthritic knee and you're practically bone on bone, or maybe
Right.
just a little bit of cartilage left, you can't get stem cell and expect that your knee is going to go back to the way when it was 16. It will help it. It should help it. I'm not going to say it will, but it absolutely should help it. It should improve it. Yes. And I believe, tell me if I'm right, but I believe there will be some new cartilage growth, but we can't expect it to be this brand new 16-year-old knee. So I think it's important to have realistic expectations and know that you're still going to have to do the right therapy afterwards. You still may have to modify your activities. At some point in our lives, our joints don't love high impact activity anymore. And so you may need to adjust and change, but I think that this is a real valid option. Well, let's take a break. Let's see if we can extract some stem cells from our own hips as we're on this 30-second break, and we'll be back with you. We're going to hear from our sponsor, iMove PT. iMove PT is proud to be the sponsor for the Healthy Habits for Active Aging podcast. iMove PT is a mobile physical therapy company based out of St. Louis, Missouri, and expanding throughout the United States. We bring a unique one-on-one physical therapy experience to the privacy, safety, and convenience of our patient's home, office setting, or the location of their choice. For more information about iMove PT, please go to www.imovephysicaltherapy.com, or feel free to email us at info@imovephysicaltherapy.com. Have a great day. Okay, well, welcome back. Thank you to our sponsor, iMove PT, for continuing to be our sponsor on our podcast. We are getting back to the topic of stem cells and what they are and what stem cell injections are and how they're used and things of that sort. We're going to talk about a common musculoskeletal injury, area of injury, lower back pain.
So from a prior podcast, we all know that a lot of adults, 80% of the population, will experience low back pain at some point in their lifetime. But low back pain affects like 68% of people older than the age of 60 worldwide. So what can stem cells do for you? Well, stem cell therapy has shown to be beneficial for the management of degenerative disc disease. So any type of disc pathology, stem cells have been known to help restore the disc cellularity and minimize the inflammatory response within the disc. So
Right.
same process.
Go ahead.
No, I was going to say same process. Bone marrow is extracted from the pelvis, the iliac crest of the pelvis, and then pretty much put in a centrifuge to concentrate like a cluster of stem cells. And then those stem cells are then injected to the area of inflammation or the area of injury, where they will recognize where they were at and differentiate into a ligament or part of the disc, which is the annulus fibrosis, which a lot of time has tears. And so that can regrow and help. But then, it's still an area of weakness. So then physical therapy can help. Another
Absolutely.
shameless plug for physical therapy.
Absolutely. We got to keep putting that plug out. We only have one body. You only have one body. Once that body breaks down, if you don't do anything about it, it will continue to break down. I'm here to tell you. And there's also with stem cell, there is starting to be more and more research out there. And there's studies out there that talk about the lower back and stem cell injections and decrease in inflammation. So it is valid. There is some really, really good studies out there. And this is Lauren and I we're talking about this, but it's not covered by insurance. And correct me if I'm wrong, Lauren, because it's not FDA approved. It's FDA regulated.
Yeah, FDA regulated and FDA monitored, but not FDA approved.
Okay. So we were talking about that. I'm not sure the steps that it's going to take to get there, but this is still, and I'll ask Dr. Bays when I talk to him when stem cell injections started, but this is still a very young science in the whole scope of things. This is a pretty young science still. And so, we want to talk about age. We are the Healthy Habits for Active Aging podcast. And it is true that unfortunately, as we age, these stem cells do decline. They start to decline early after the age of 60. And I will ask Dr. Bays about this, but I'm pretty sure by age 85 and above, that this may not be an option for a person with knee osteoarthritis to get stem cell injection. But I will ask him about that. I just don't know the amount of stem cells that are left, especially like after age 85 or so.
Yeah, and you'll have to ask him too, because I think it varies depending on where the stem cells are coming from. So I know that they depreciate after the age of 60 in bone marrow, but they're not supposed to depreciate from fat. So I'm not sure like what Dr. Bays does on where he gets, if he's a lot of bone marrow or if he does any other type of extraction, but worth asking.
Well, if that, for me, that's good. That's good that they don't die away in fat. I'll be ready for that. Okay. So other things to expect. We've talked about some of this already, but obviously it's an injection, so you very much could get some soreness for a few days afterwards. You may need some type of anti-inflammatory. You may need some ice, things like that for the first few days, just after any injection. Don't expect that, full healing is going to happen quickly. It's going to take up to a year. I tell anyone that has surgery of any kind, expect that it's going to take a full year. Not that you'll be in pain for a full year, but as far as the actual tissue that's being treated, whether it's a tendon, ligament, a disc, whatever it is, it takes about a full year for that collagen, that tissue, to really repair itself. So it's not just going to be an overnight thing.
Very true. So, okay. Well, just to recap a little bit of today.
I think, hold on one sec. We should probably talk about, sorry, kind of, I forgot to say something before I turn it over to you. This doesn't last forever. And Lauren, you may have said this earlier, but on average, a stem cell injection and the effects from it last about 5 to 7 years.
Yeah, I wasn't sure on that. So I mentioned that, but we'll confirm that next week with Dr. Bays, because I know it can be kind of very subjective on the person. So
absolutely. Well, we want to thank you all for joining us today, wherever you are in the world, as we talk about stem cell and its use in regenerative medicine. This is a very exciting topic for right now. It's an exciting topic for patients that have orthopedic injuries, musculoskeletal injuries, things of that sort. But I'm going to guess within the next 10 years, this is going to be exciting for people with Parkinson's, perhaps MS, perhaps other types of things right now that there's no real, I don't know. There's no real cure. Not saying that stem cells are going to cure it, but we're excited for what the future of science holds.
Yes. Thank you again for joining us today. And please tune in next week. Dr. Bays is going to bring much more information for you all on stem cells and hopefully some platelet-rich plasma as well. So between now and then, if you have any questions, particularly about it, please email us at info@imovephysicaltherapy.com. And Dr. Gorman, when he interviews him, will be sure to ask him your question.
Absolutely. And please, if you know someone that's talked to you or has a friend that's talked to you about stem cells, share this podcast with them, and for sure share the next one that we're going to do with Dr. Bays, where we interview Dr. Bays. Share that as well. Our goal with this podcast, we definitely want to have some fun, but our goal is to provide as much education as we can. The better educated our patients are, I think the better outcomes we'll all have. And there's a lot of information out there, and really our goal with this is just to share as much good scientifically based information to give the active aging population, to keep them not only living for a longer period of time, but living very healthy for a longer period of time.
That's right. All right.
Well, I hope you all have a great week. We're excited to have you back next week. Thank you as always for giving us your 20-30 minutes of the week. We know you could be anywhere and you chose to spend that with us. So both Dr. Bennett and I are very grateful. We hope you have a great week.
All right. Thank you.
All right. Bye-bye.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.